everybody, welcome to my channel Island Daily. My name is Dr. Eamon and I'm an optometrist, and today we're going to learn the detail of paranasal sinuses. They are called paranasal sinuses because they are close to the nasal region. Now, there are four paranasal sinuses. The first largest one is maxillary, then comes frontal, then comes sphenoid, and the last one is the ethmoid sinus. A sinus is a structure which is present inside the bone. To understand this, we first have to learn the composition of a bone. A bone is composed of an external table, an internal table, and between this external and internal table, we have a spongy bone which is called diploic. Now, the periosteum covers the external and internal table. The outer periosteum, which covers the external table, is called epicranium, and the periosteum, which covers the internal table, is called endocranium. And do you know which periosteum, which covers the orbit, is called ischia orbita? Now, where does the sinus forms? When the internal table splits, this is the internal table, this is the external table, and this is diploid, and so is on the other side. This hollow this hollow space forms the sinus. The endocranium, which was covering the internal table, now becomes the mucoperiosteum. The function of mucoperiosteum, it consists of mucus glands which will produce mucus. This mucoperiosteum consists of cilia which moves this mucus into the nasal cavity, and this mucus is drained from the nasal cavity through the siphon action. In lay terms, siphon action is the action of blowing the nose. Sinuses are not filled with mucus, rather they are filled with air. Only a small amount of mucus travels from the mucoperiosteum through the cilia into the nasal cavity. Now, what is the significance of these sinuses? They have four major functions. Number one is that they act as excellent voice resonators. They help to reduce the weight of the skull. They act as thermal insulators. They help to regulate the temperature of the surrounding tissue. And they act as a buffer or shock absorber in case of any trauma. Now let's understand through what passages these sinuses drain into the nasal cavity. To understand this, we have to make a diagram. These are the diagrams of sagittal section and frontal surface of the skull. Now, this is the sphenoid sinus. These are ethmoidal sinuses. This is posterior ethmoidal sinus. This is middle ethmoidal sinus. And this is anterior ethmoidal sinus. This is the frontal sinus. And because this is the sagittal section, you cannot see maxillary sinus here. You can see right here in the anterior surface, this is the maxillary sinus. Now, there are three turbinate bone processes, which you can see right here. This is the superior concha. This is the middle concha. And this is the inferior concha. Superior and middle concha are a one bone and inferior concha is a separate bone. Now, below the superior concha we have superior meatus. Below the middle concha we have middle meatus right here. And below inferior concha we have inferior meatus. Now, let's discuss how these sinuses will drain into the relevant meatus. The maxillary sinus, which is the largest sinus, will drain from this small opening into the middle meatus. This is the middle meatus, this is inferior meatus, and this is the superior meatus. This is superior concha, middle concha, and inferior concha. Now, the maxillary sinus will drain from this small opening into the middle meatus, and this opening is called hiatus semilunaris. The frontal sinus will drain with the help of frontonasal duct, which is also known as ethmoidal infundibulum. The frontal sinus will drain from the frontonasal duct through the hiatus semilunaris and into the middle meatus. This is the frontal sinus and it will drain through the hiatus semilunaris into the middle meatus, right? The anterior ethmoidal sinus and middle ethmoidal sinus, both of them drain directly into the middle meatus. And the posterior ethmoidal sinus, as you can see that it is close to the superior concha and superior meatus, it will drain into the superior meatus. The sphenoidal sinus, in 52% of the cases, drain directly into the supreme superior meatus, which is also known as sphenoidal recess. And in the rest of the cases, it drains into the superior meatus. The nasolacrimal duct will drain into the inferior meatus, right here. Since these sinuses have mucoperiosteum which is producing mucus, these sinuses have their own nerve supply, vascular supply, and also lymphatic drainage. Let's make a table. Now, the nerve supply of the maxillary sinus is infraorbital nerve and alveolar nerves. Well, alveolar nerves are branches of infraorbital nerve, and infraorbital nerve is the maxillary division of the trigeminal nerve, which is the fifth cranial nerve. The blood supply is through infraorbital artery and maxillary artery. The venous drainage is into the venous plexus of the nose. The lymphatic drainage is into the submandibular node. The frontal sinus is supplied with supraorbital nerve, which passes through the supraorbital notch. The blood supply is through supraorbital artery and anterior ethmoidal artery. The venous drainage is into same venous plexus of the nose, and the lymphatic drainage is same into the submandibular node. The ethmoidal sinus is supplied with nerve supply anterior and posterior ethmoidal nerves and orbital branches of the pterygopalatine ganglion. The blood supply is through the anterior and posterior ethmoidal arteries and sphenopalatine artery. The venous drainage is along with these arteries, and the lymphatic drainage. We know that ethmoidal sinus are divided into three portions: anterior, posterior, anterior, middle, and posterior. So the anterior and middle one will be drained into the submandibular nodes, and the posterior one will drain into retropharyngeal node. Since the sphenoidal sinus comes after the ethmoidal sinus, so the ethmoidal sinus will share its nerve and blood supply with the sphenoidal sinus. So the sphenoidal sinus is supplied with posterior ethmoidal nerves and same the pterygopalatine orbital branches. The blood supply will be from the posterior ethmoidal Arteries. The veins will drain into posterior ethmoidal veins. As I've told you that the veins will travel along with the arteries and this ethmoidal sinus, and the lymphatic drainage will be along the in the retropharyngeal nodes. So this was the anatomy of the paranasal sinuses. You may have seen in this video that how close the sinuses and their openings is placed to the orbit and how easy it is for any infection to travel from these sinuses to the orbit. So that's it from today. I hope you like this video. Please like and subscribe and bye bye.